So fortunately, we don't run into a lot of bone fractures or anything like that. We might, in a search and rescue type of mission, if there's been some type of disaster or area, that you might see more broken limbs in those scenarios. But fortunately, we don't see a whole lot of them. If the limb is obviously broken, definitely you need to seek veterinary care. The biggest thing we have to do is stay calm, and I am a very true believer that dogs and cats can kind of sense our urgency and our anxiety. And so if we're panicked, if we're really not handling the situation well, I think they feed off of that, and I think they really can get pretty worked up as well. And that worked up could be they can get nervous, they can be aggressive sometimes. So always approach these patients, whether they're your own pet or whether they're somebody else's pet, approach them with caution. And every pet that has been injured, especially to this extent, has the capabilities of biting or scratching. And so in these scenarios, it is 100% appropriate to use a muzzle. And these muzzles are not meant to be a discipline device or anything like that. It's not cruel. It's just protective for both the pet and then also for you as well. So if there's an open wound, what you want to do is you want to carry the animal as gently as possible, get them to a place where you can mobilize them and take them to a veterinary hospital. What if you're dealing with a 100-pound dog and you're by yourself? Well, it's always good, and I like the idea of having a blanket in your truck or your trunk at all times, just having it available. Blankets are great for many things, for hypothermia, etc., but also works as a great stretcher. You can put the pet on the blanket. You do two things. If there's two people, then you can use that as a soft stretcher. But if there's only one person, once you put that pet onto that blanket, you can use that kind of as a sled of sorts and get them to your vehicle or get them to a place where you're able to load them into a vehicle. It really is a lot of help to use. If there isn't an open wound, then that's when you can just monitor the patient. You don't want to set the fracture. You don't want to play Quincy and straighten the leg, put a brace on, and then monitor it for a couple of weeks and see how good of a job you did. You can really get into a lot of damage. Both blood vessels and nerves run pretty close to the bone, and so by manipulating a fracture, then we can actually damage some of those a lot more. The best thing is to just keep the pet calm, also get them, again, loaded onto some type of stretcher, and then get them to a veterinary hospital as quick as possible. If it is an open fracture, just treat it like an open wound. You can flush that wound with just a saline solution, but then cover that wound to try to prevent further contamination. Don't attempt, again, to bandage the limb in any of these cases. The bandaging is extremely painful to these patients without any type of anesthetic or with sedation, and then also you can do quite a bit of damage.